In October 2020, my mom wanted to go to McDowell for a breast exam and she wouldn't go along. So I took her, me and her we went in for just a breast exam and to check my thyroid level to make sure that maybe it was my thyroid that was causing no energy. I would get sick and throw up sometimes. My doctor called me back and asked if I would go back to the hospital at McDowell to have more blood drawn. They found that my blood level was a 5.1. when normally it should be at least 13. So my doctor decided to transfer me here to Hazard ARH, where I would receive 3 pints of blood. And from that point on, we decided to try to eliminate what was causing me to lose the blood. I agreed with my doctor to do a colonoscopy. When I asked the nurse if she could tell me anything about my colonoscopy, she told me that Dr. Mularz would want to speak with me. And at that moment, I knew it was colon cancer. He came in and he talked to me. I was alone. Hardest thing ever. So all I could do was just look up and say, God, this is your battle. This is not mine. I can't do this alone. And from that moment, he took off. So Dr. Mularz went ahead and set up an appointment with Dr. Brashear for me to come in for a surgery consultation. When me and my mother came in, I seen this man downstairs and he was getting ready to get on the elevator and he was really sweet and he said, no, you get on first. And I come up here and I get checked in Dr. Chad Brashear's office, and as I was sitting there, in walked that man that was so nice to me, and it was Dr. Chad Brashear.
I'm Dr. Chad Brashear, one of the general surgeons at Hazard ARH Hospital, and I had the opportunity to meet this young lady. GI physician Dr. Mularz was able to ask me for a first surgical consult, and when I saw her, she had colon cancer, unfortunately, but she found it at an early detection and an early time.
At that time, he said, I want you to know something, and I said, what? And he said, we're a team, and I said, a team? He said, yeah, we're in it together. We're in it till the end. And at that moment, that meant more to me than anything. I wasn't just a number to somebody, that they were going to be by my side the whole time. You don't find that a lot at hospitals. So on December the 7th, I went in for my surgery. I remember just laying there and all of a sudden someone looked over and smiled at me, and it was Dr. Chad Brashear, and he said, we got this. The test came back and Dr. Chad Brashear FaceTimed me. He let me know that it was in 1 lymph node out of 22, which means that I was going to have chemo. My hospital stay was nothing short of amazing because my nurses were very caring to me. The night that I got the news that it was in my lymph node, a nurse bent down and held my mom's hand and just cried with my mom.
So after she had her surgery, had a long discussion about the treatment option, what treatment would look like, what she may experience, what the side effects may be. She understood the evidence, she reviewed things herself, and we went ahead with the decision of 4 cycles of chemotherapy. Initially, the first chemotherapy is the most difficult because no one knows what to expect. As an oncologist, we see people getting therapy all the time, but for her as a patient, this is brand new. And so really nervous, really anxious, but did well with her treatment. After the first treatment, she knew exactly what to expect, and the other 3 went very well.
On April 14th, I took my last IV treatment, and I was able to ring the bell.
The first 3 years are going to be our most crucial. That's when we see most of our recurrences. After the 5-year mark, it's very uncommon to have a recurrence of this cancer. Now, due to the fact that she did have 1 cancer, we will follow very closely with colonoscopies and further exams of her bowel to make sure she doesn't have any more polyps.
If you would like to have your screening colonoscopy, you can talk to your primary doctors and they can set you up a surgical clinic, and we can get that scheduled for you promptly and try to diagnose these early colon cancers and try to get everybody treated appropriately so that way we can fight this battle.